Hi, everyone, and welcome to our session. We are going to go over some introductory information. My name is Paula Zaremba, and it's my pleasure to welcome you to our session on creative solutions to advocate for care. So we're delighted you could join us today and hope you're having a wonderful morning. So while I'm covering introduction information, we invite our participants to write in the chat where you are joining us from today. Please introduce yourselves. So I wanted to start off by saying Emotions Matter is a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for those impacted by borderline personality disorder, or BPD. To learn more about us and our programs, go to our website, www.emotionsmatterbpd.org, or head to the expo. Emotions Matter strives to create a safe, judgment-free space for people with borderline personality disorder. We accept that there is a spectrum of experiences within the BPD community. We honor where people are on their journey without judgment or assumptions, and we encourage people to define their own path toward recovery. We speak as experts of our own lived experience, not as medical experts. Questions during our session today should be asked using the Q&A box, not the chat. Comments can be made in the chat. Please use respectful language in the session chat. Any inappropriate messaging, including harassment, bullying, or monopolizing the chat, will be deleted. We accept differences and promote acceptance, especially with regards to gender, sexual orientation, identity, race, ethnicity, age, religion, disability, or politics. Please avoid explicit expressions of self-harm or trauma, which may be upsetting to others. Panels and plenary sessions will be recorded and available after the conference. No screenshots or recording on personal devices. We have some safety guidelines and disclaimer. If at any time during BPD Fest 2022 you find yourself overwhelmed, struggling, or for any reason in need of support, we encourage you to reach out to your support system. Audience members may experience intense and painful emotions, feelings, memories, thoughts, and/or reactions to content shared. Participate at your own risk. You're also welcome to take a break from BPD Fest 2022 at any time or withdraw from it entirely. And in the event of medical, including mental health emergency, please seek care through a doctor, hospital, or emergency call number. With that, I'll go ahead and stop sharing my screen and pass it over to you, Daniela Labate Covelli, to moderate our session today.
Great. Thank you so much. So welcome, everyone. My name is Daniela Labate Covelli. I'm a volunteer here at Emotions Matter. I am a person who has not turned off their notifications in the background. Sorry about that. And I'm also someone who has been impacted with BPD through family. So it's my pleasure to be here. I'm going to be moderating today's discussion. So I'm going to actually turn it over to our panelists to introduce themselves. Mary, do you want to start us off?
Sure. My name is Mary. I'm living in Central Illinois right now. I'm in Springfield. I am involved, I volunteer with Emotions Matter because I have borderline personality disorder myself, but I also am a psychiatric nurse and in school to become a psychiatric NP, and so I kind of have both perspectives. It's something I'm really passionate about, both as someone with lived experience, but also as someone who advocates for my patients. And I overcame about 7 years of BPD suicidality in my 20s and am now in a strong place in my life where I can help others. So thank you.
Great. Welcome. Catherine? Catherine Leanne,
Hi,
sorry.
That's okay. I'm Catherine Leanne. I'm currently in Costa Rica, although I live in Cambridge, Massachusetts. I volunteer with Emotions Matter. I was diagnosed with BPD in 2017 and have been in treatment since then in what I would say is an ongoing nonlinear process. I feel like at this point I've made it through the worst of the process. I guess I hope so anyway, and lived through some pretty difficult years. So I'm really grateful to be here, and I'm really grateful to be here in part because last year was the first coming to this BPD Fest was the first like public thing of any kind that I did. The first time I really talked to anybody or saw anybody outside of just group DBT therapy that affiliated with BPD, and it was a real big moment for me to even come. And so now to be able to volunteer and to speak and is really I'm grateful and excited to be here.
All right, thank you, Ayala.
Hi, good morning, everyone. My name is Ayala. I am a psychiatrist in Connecticut. I'm also completing some subspecialty training in forensic psychiatry. I became involved with Emotions Matter about a year and a half ago. I was very fortunate in my residency training in psychiatry, to work with a psychiatrist who's involved with Emotions Matter and who is involved in research in BPD, and who really introduced me to recovery in BPD and how wonderful it can be to work with who have BPD, and how important it is to learn from folks with lived experience. And so I have been involved with Emotions Matter. I'm on the education committee, and I was on a panel last year at BPD Fest and learned so much from my co-panelists in preparing and then being on the panel together. So I'm excited to be here as a psychiatrist and also to be here as a learner. So thank you for joining us today.
All right, great. So welcome again, everyone. I'm going to jump right into the questions, but in just a second. But before I do that, I just want to encourage. We have about 70 folks out there that we can't see but can see us. So, we want to try to connect with you as best as we can. So if you have any questions for the panelists, please feel free to chat them using the Q&A, just a reminder. And then if you want to, have conversations with each other, you can do that in the chat box. We'll be checking that throughout, and we'll set aside some time at the end for questions, definitely. So our first question is, when and how were you first diagnosed with BPD? Maybe you could share a little bit about your experience. Catherine Leanne, do you want to start us off?
Sure, I'd be happy to do that. And I realized I didn't mention my my occupation. I'd just love to share that. First off, I'm a mindset coach and spiritual teacher, and I have a background in history and public history, which kind of feeds into my diagnosis story. I was in graduate school trying to finish my master's degree, and my marriage started to come apart. I had just gone overseas to Germany for 6 months to get a job at Adidas in their history department, which was like the coolest thing I had ever done, and felt like my life was like really about to take off. And then my husband basically started, our marriage started to end. And I can really trace the beginning of my most intense symptoms to that time period. And I just had no idea what was going on and what was going on, and then why I was reacting the way I was, and any of it. So the marriage ended, and I found myself immediately on the heels of that in a fairly abusive relationship with someone that also has his own set of mental struggles. And it became, in a way, a helpful information for me to kind of begin to ask, like, what is going on, and why am I reacting so badly, and why is this so difficult? And probably about 6 months later, I ended up in a psychiatrist's office for the first time, and I was 38 years old, maybe 37 at that time. Can you still?
Yeah, we can hear you now.
Oh. Yeah.
Is Catherine Leanne frozen on everyone else's screen too? Okay, I want to make sure it wasn't my connection. So you all know she's abroad, so I think that has something to do with that. So why don't we jump to Mary, and then, oh, wait, I think she's coming back.
I can hear you. Can you hear me?
Okay. Yeah.
Okay. My apologies, everyone. The internet just kind of pops in and out here. So yeah, so my family really thought that it was related to all the other people in my life and that they were creating these problems for me, but it wasn't me. And I said, no, I really think something's actually really going on here for me. And this really fits. And it was a relief because basically all my life trying to figure out why I felt different and why I was responding to life differently than my peers, and why my life just didn't seem to quite fit, and why I struggled with decision making, and why I struggled with stress so much. And so for me, it was like the falling apart and the crisis situation that kind of finally put me in a position to figure out what was going on. And I was relieved when I got the diagnosis, actually, at that point. And then, I've had like, I don't know, up and down relationship with that feeling, that initial feeling. But overall, I've been really grateful. I was diagnosed by a psychiatrist initially, and then a second psychiatrist actually diagnosed me at the Amen Clinic. And that was like the thing that was like the full punctuation mark I needed to be like, okay, I've really got to go deal with this. He was very helpful as well to help me figure out what to do. A lot of empathy and direction.
Mary, do you want to jump in and share a little bit?
Sure. So, like I said, I struggled for many years with suicidality, beginning in my late teens into my 20s. And I actually got a bipolar diagnosis early on, which I learned was a misdiagnosis. But I was misdiagnosed with that for many years. And because of that, I think struggled more than I needed to, because I was put on so many different medications that weren't appropriate. None of them were working very well. And I saw dozens of therapists, none of whom seemed to know how to respond to me or offer me insight that was helpful. And so it was really quite a journey. And I actually discovered that I had BPD on my own without professional help, and then sought out specialized treatment. So in a way, I kind of diagnosed myself, and that's why I think self-diagnosis is valid when it comes to BPD, because there's so much misdiagnosis out there. Obviously, going to a professional and getting confirmation and then getting, appropriate treatment's important. But I think sometimes for us, because there's so much misinformation, even in the professional world, or just not enough education, really, I think that is valid, and that is a way to start your journey. So, after I realized I had BPD, I sought Dbt treatment. And for the first time, I had a therapist. He was a psychologist, a Dbt psychologist, and he really changed my life. And he never said it, but I think he probably struggled with some of the things too. And I think that gave me the inspiration I needed to do the same for others. And I think, of course, my education as a nurse, as psychiatric NP is important, but it's amazing how much people respond to me because of as someone with lived experience in my profession. So, and that is something I'm open about. So yeah, that was my journey.
Ayala, did you want to jump in there and maybe respond a little bit?
Sure. I think
I saw you nodding your head a whole lot, so yes. I know you've got something to say.
Well, yeah, I think, the experiences that Catherine, Leanne, and Mary are sharing are important, and I think many people can relate to them. And from the, side of a psychiatrist, I think when I think about the patients who come for help to my office who have BPD, they sort of fall into three categories. Some people who come in and they have no idea what's going on, stress, and they know that they're in a lot of pain and they want help. Some people who come into the office and are very clear that they have BPD and want help for it. And then there are some people who are sort of like in the middle. They think maybe it's BPD, maybe it's something else. And all of those approaches are really valid, and I think important when you come into treatment to bring in what's on your mind. I think self-diagnosis is not uncommon. I almost wish it was more common that people had the information to say, I think my experience is BPD, and let me go talk to someone about that. And hopefully over time, more of that information will be out there, because the experience that Mary shares of being misdiagnosed is very, very common. And, you know, like Mary said, she struggled more than she needed to, 100%. And sadly, I've seen that a lot. People who are being tried on many, many medications because they're trying to control their bipolar disorder when that's not the problem. and treatment for bipolar disorder isn't going to work for BPD. So I welcome very much when someone comes into my office and says, I think I have BPD and here's why. I have not had the experience of someone thinking they have BPD who didn't. People really are on the nose with that because they can relate to the criteria. And so I wanted to just comment about the self-diagnosis piece, and also I think there can be a big relief that comes with having the right diagnosis. And I think when you feel that with a treater, that can be a good sign that this is someone who thinks I have BPD and they're eager to share that with me and to work on it with me. And I think that could be a really good signal that this treatment relationship has some potential.
So that's a pretty good segue actually to our next question. It's like you knew what they were. So we talked a little bit about like finding the right diagnosis and having the right diagnosis, but what about finding the right therapist, right? So can maybe our panelists speak a little bit about any challenges that you faced in trying to find the right fit for you?
So sure. I think, like I said, I saw many therapists, and I'm talking about dozens before I found, and again, it was a psychologist, not a psychiatrist, who did therapy with me and really helped me. And so, yeah, there are differences between treaters. There are a lot of master's prepared therapists nowadays. A lot of times it's hard to find psychologists, especially if you're in a rural area, because they're just more expensive for insurance companies, to be frank. But master's prepared therapists are good too. And there's also psychiatrists, and psychiatrists are the ones that usually manage meds. Some of them do therapy. Insurance doesn't really cover it as well, so that's happening less and less as time goes on, I'm sure, Ayla. But it's the way I found my psychologist was probably a Google search at the time. I mean, I didn't really know about I didn't really know much about the Marshall Linehan story. I think I came across DBT and I probably searched that, and I found a DBT clinic. I was living in Hawaii at the time, and I found a DBT clinic. Again, they're not super common if you don't live in big urban areas. So it's not gonna. If I live in Springfield, Illinois right now, there is nothing like that here. I would have to travel to Chicago or St. Louis. Thankfully, because of the pandemic, insurance companies are now covering virtual care a lot of times. And I actually have come across a lot of DBT groups that are now virtual. So I'm getting some of my patients into virtual DBT through Chicago and stuff. So that's really cool. That's something you can look into. But yeah, it started off as a Google search. Marshall Linehan's website, DBT website, has a list of people who have been trained through her. And there are other treatments for DBT too, and we could probably go over that at some point. But this is kind of the one that's probably most well known, and that helped tremendously. Since then, I haven't been able to find. Now that I moved back to the mainland, I haven't really been able to find someone at the same level. But I think the most important thing is when you go in, when you make the call, ask, "Are you comfortable with BPD? What are your therapy approaches?" And people will actually be quite honest. No, BPD is more complex than I'm willing to handle, or what have you. Some people, a lot of therapists don't have the education for it, don't really understand it, and aren't going to be validating. And honestly, I believe so strongly that if you have the wrong therapist, they could do more damage than good. And a lot of times we have trauma histories, so that's especially unhelpful, right? But so yeah, people will be quite frank if they are not willing to, help you in that way.
Yeah. So I wanted to first say, Alana, thank you for your comments about self-diagnosis. I think one of my biggest barriers to therapy was a lot of the people around me. I often feel like I don't have what I kind of hear is a very consistent BPD story. I didn't have, I I didn't have like self-harming behaviors or suicidality or hospitalization or any of that as a teenager or my 20s. A lot of my like issues erupted through relationships, but in a way that I always kind of seemed somewhat normal enough. And I had family members and a lot of people close to me that kind of had some, I felt like agenda for me to be like okay or normal or not get help. And so I would try to pursue therapy at younger ages. And some people really close to me who I really trusted would just be like, you don't need therapy. This other person who hurt you needs therapy. And then I would be like, okay. And then, like I wouldn't do it. Or I would go to therapist and I would run circles around them. Mentally or cognitively, I would just like, I would, there's like a mental defense system I have where I just sort of can, I know more than they do. I can break them down. In some cases, that was actually even true. My awareness is really high, but then the connectivity is the issue, and no one could really land on that. Therapists would think I was really knowledgeable and, everything was going great, and then I, wouldn't really get better. And so, after things got bad enough in my life and I became willing. So I think willingness for me and breaking down the barriers of the people around me who were telling me not to go were sort of my first issues with finding a therapist. And also like allowing somebody, like figuring out what's going on, allowing somebody to help me with that. Once I got sort of beyond that and could figure all of those things out, the first therapist, I actually started with online therapy, just like where you would like type in and talk to somebody. That was the very first thing I ever did. And I did that for almost a year. And then the first therapist I got was not a BPD therapist at all and actually did not diagnose me, missed it completely, and admitted to me, everybody that she's ever had that was diagnosed with BPD, she didn't catch it. And so once I actually got the diagnosis and was like, okay, we have a known problem, and then here's the solution, is DBT. I was actually in visiting. I was staying with family since we were in my divorce in Alabama, either in Birmingham or in rural Alabama, one of those two places. And I normally live in Massachusetts, so this was quite different to be there and get diagnosed there. And the options, there weren't a lot of options. There was one good option 2.5 hours away from where I was living, and I would drive once a week to go to UAB hospital, and did a lot of research and tried to call around. And at the time, there just wasn't a lot of options. And also, thankfully my insurance covered it there, but I was going through divorce and about to lose that insurance. So then when I got back to Massachusetts, I had the opposite problem. I had so many options. And it was actually really difficult to sort through those options. And my insurance was changing. And it felt like it was a puzzle with all of these different missing pieces or pieces I had to go find before I could put it together. I found a resource. Some of you might know Amanda Smith. I found her really early in the process. You can Google her, Amanda Smith. BPD, Hope for BPD is her website. And I would say she was one of the greatest resources for me early on, because she's dedicated her life to helping people who get to that moment and are diagnosed and just don't know what's going on and don't have anybody around them who can help. This was a language to me. I have a lot of great research skills from my profession. So I was able to kind of like isolate for a few months, just sit down and do tons of research and begin to try to figure out where to go. And I looked at maybe going to Washington because Marsha Linehan was there. And then I ultimately decided to go back to Cambridge. And then I just started researching therapists, and I started asking a lot of questions about like very specifically, Amanda gives you 4 questions. I think Marsha Linehan does too. 4 questions to ask if you're looking for DBT specifically. So that was, are they in like a DBT consortium of other therapists? Do they allow text messaging? Oh gosh, I don't remember all 4 of them now. Do you remember, Alana? There's 2 more. I'll remember at some point in the session, I think. Sorry, I thought I had them right on the top of my head. But I asked every single therapist those questions, And the other big barrier was still I had to pay out of pocket, and insurance had to reimburse me. And that took a while. And I didn't even know how to fill out those forms. It took me like a year and a half or something to even get around to doing it, because I didn't know how to do it. And I wasn't in a cognitive space where I could really deal with that. So I think there were just a lot of barriers. And then ongoing, I've continued to have to, once the DBT was over, which took a while, I've had to continue to find other types of treatment that I thought were going to be like the next thing that made sense for me. So I feel like just a lot of navigating what feels kind of like a wilderness. And then I will say on the positive end, I do feel really supported, and I am in a place where there's a lot of options to care. Cambridge is a great place to get therapy. So that's been really great. It's just a lot of asking hard questions and making sure that the therapists are okay with BPD, and that I also want to see that they're empathetic, and that they're like, I need both. I need someone who's going to help me get beyond that like mental game that, you know, I need to know they're not going to let me snow them over. And I interview therapists to figure that out. Like, are you ahead of me? Are you a few steps ahead of me? And can you get me to be vulnerable enough to like do the next thing? But then also, are you not going to be hard and critical and harsh and, you know, drive this hard line? And I want to see the combination of those two things show up in a therapist.
Yeah, I think one of the things I think about when I hear both of you speak, and when I think about establishing a treatment relationship, is the importance of fit. And, you know, fit is critical in a therapist-patient relationship, regardless of the diagnosis. I think because many clinicians out there are not well educated in BPD. Many might hold outdated views of BPD that are loaded with stigma. Fit becomes really, really important in finding treaters when you're seeking treatment for BPD. And I think the question about how comfortable are you, like what is your comfort with BPD, is a great question. That the notion of interviewing therapists is really important. You want to find a therapist, psychiatrist, whatever the particular kind of treater you're looking for, to be able to ask the question, and sometimes even the question of, I think I have BPD, or I have been. What is your approach to BPD? The role of a therapist is partially a role of educator, to help people understand the diagnosis and to help people understand how together they can work through to achieve recovery. And so asking those questions up front and asking of the potential therapist to give you a taste of that education, I think can be really helpful, because not every approach is going to work for every person, right? Even hearing here, people's experiences of BPD are very unique, one to the next. No two people have the same experience. No two people have the exact same symptoms. And there are a lot of, DBT is probably the most well-known therapy, evidence-based therapy for BPD. There are other therapies too that sometimes work better for an individual, like mindfulness-based therapy, or just a more general good psychiatric management approach, or transference-focused psychotherapy, escaping my mind right now. And so it's okay, and I think important not to feel locked in by one particular approach, and by one particular fit. So there, if DBT is the kind of therapy that works for you, but the DBT person you've connected with isn't a fit, or feels invalidating, or feels just not like they're really getting you, it's okay to try to go elsewhere. And I think there is the reality that there aren't enough therapists who are well trained in BPD. There aren't enough psychiatrists and other treaters who are well educated to provide an evidence-based treatment. Sometimes those therapists and those psychiatrists can be enough to hold you over also. And so that can also be a question. You don't have training in a specific modality. Do you feel like we can work together while I find that? And making sure that person is well versed enough in BPD to be able to provide compassionate, empathetic, and not judgmental care. From my perspective as a psychiatrist, there are no questions that are off limits about my treatment approach. And so if you're coming into a therapy or a potential therapy, and there are questions you have, such as, how available are you outside of session? Or how do you handle chronic self-harm or suicidality? Am I going to be hospitalized every time I bring that up because that's present for me every single day, and I want to be able to talk to my therapist about it. Those are reasonable questions to ask. And if the response you get feels like the person doesn't understand, that may be a signal that they're not the right person for you, or that may be a signal that more discussion needs to be had with them. Certainly, if the response is very invalidating, to me, that's usually a signal that, this is not the person I meant to work with. And potentially not even a person who I can work with short term while I find someone who's a better fit.
That's a huge one. If you don't mind me chiming in right there, is, people with BPD often have daily, if passive, suicidality, and self-harm is common. And if you were to throw someone with BPD with those symptoms in the hospital every time they admitted them, I mean, they would live there, which isn't realistic. So, yeah, it's really important that you have a therapist that understands, how to deal with that, because some are very kind of, I don't know, just very formal and you meet criteria to go inpatient, so I'm going to send you there. I'm going to call the cops on you, which, is traumatizing. I rarely do that for patients. So that's a really important question. I just also wanted to say something about my own therapy experience. My psychologist was not only trained in DBT, but schema therapy. And schema therapy helped me better understand. It gave me a framework to better understand my behaviors, whereas DBT gave me the skills I needed. It's DBT. There's homework. It's not really asking you as much to reflect and process, though it does. But schema therapy helped me better do that, and then DBT gave me the skills I needed to actually change how I'm interacting with the world. And I think it's the combination. So yes, it's important, I think, sometimes to have different modalities. Because it was the combination that really helped me. For years, I had therapists who just listened to me, and I even had some therapists that talked 24/7. So my psychologist that I finally had a combination of that. About 50% of the time he was listening to me and I was processing my stuff, but 50% of the time he was educating and he was, facilitating that. So I think that's an important balance as well.
So we have gotten so much information from you all today. I just want to take a pause and say thank you for that. I mean, we've heard about, intrinsic and extrinsic sort of challenges that you faced when trying to seek treatment and find therapy, which I might come back to that if we have time. I think the questions for finding a therapist are going to be super helpful for people that are out there listening to you guys and to us to try to find some treatment. But I also want to touch on something, Ayala. I think actually you started to bring this up around partnering and really becoming a partner in your recovery. So I want to spend some time talking about that and ask you, how do you make decisions together with your provider and really partner to work towards your recovery?
I can respond to that. I want to go back first to what I think for me is the introductory process of interviewing first. So my partnering with my therapist always begins early. I like to have at least a 15-minute phone conversation if that's all they'll do. If I could have a full one session to meet with them as an interview session, I would prefer that. I need to be with them and see that we're going to be able to partner. I'll say that when I did DBT therapy specifically, I initially met with the person who led the program, who's the lead person who'd been doing it the longest and the most established. And she quickly said to me, I think this is going to be over in no time. You're going to be fine. This is going to go really quick. And that was one of my red flags. And I ended up saying, I don't think I do want to work with the lead person in the group, even though maybe she's more established. And she referred me to somebody else. And that person ended up being a good fit. And I actually almost didn't meet with her based on her picture. So that's another recommendation I would make is just meet with everybody if you can. Then I really like to, I like to really think, I like it when therapists help us think through goals. So what are the treatment goals? That helps to me create a container. And it also makes me feel like I'm not trying to do everything in my whole life right now or in the next however many months we're together. So I really like that. And I like simplifying it as much as possible. And I like when therapists will like allow me to say what really doesn't work for me or what makes me comfortable. And I've got a therapist now. I've done lots of different types of therapy, and I just want to chime in there that like I did really intensive like DBT therapy, and then I got a mindfulness therapist for like a year. Then I just got like a regular psychotherapist for a year, just to like help me through a hard time. And now I'm doing some more body-based therapies like art therapy and EMDR. And that therapist started off by asking me what makes me feel comfortable and how can we start, how can we get grounded at the beginning of a session? Man, I love it when therapists do that, and we can really talk about how do we begin a session and how do we close it out. And I would really highly encourage you to have your therapist have that conversation with you so you don't leave the session wide open. And so opening the session with some grounding exercises, making me feel comfortable. She made a whole list of things that we could do. Thankfully, doing DBT helped me gain that list. So before that, I really needed a therapist who could guide me through that without me having like to even come up with the ideas. This therapist guided me through it, but I could come up with some ideas. And then how are we going to close it out? And then what are our treatment goals? And what are the tools that we're going to use for those goals? And for me, that just, again, helps me contain it and not think like I have to be the one thinking of everything, or we're going to do everything there could possibly be to do in this next year because I got to get better right away. So like really slowing it down and bringing it back to what are we actually doing here? Which is hard, but it's really helpful. Yeah. And then I also like when therapists ask, like, what are we going to do if there's conflict? What are we going to do if I'm upset with them? What are we going to do if they're upset with me? You know, things like that. And I recently had to leave a therapist because she got upset with me when I was just getting emotional, not at her, just getting emotional. And I was like, yeah, this is what I'm going to do. So I need you to hold that safely. Yeah.
Mary or Ayala, do you want to respond? We have probably about 7 minutes left. So I think this might be our last question, and then we'll go to questions from the folks out in the audience.
Do you want to go ahead, Mary, or do you want me to go first?
Go for it.
Okay, thank you. So I think kind of a couple of things come to mind, and one goes back to something Catherine Leanne actually said a while back with the thinking about the kinds of questions that you might bring. And I know Mary has already talked about this a little bit too. I think, you know, the asking questions of the therapist during the sort of interview phase is can be a really useful opportunity. And some of the things, obviously asking about their comfort with BPD, how they handle conflict. I love some of the things that you already have suggested. I also think it can be helpful to ask about what happens, what's their availability outside of the session? Do they have support outside the session? For some therapists who are part of a group or who are part of a structured kind of therapy, they might have a system in place to be available outside of, you know, the once a week or a few times a week that you meet with them. Some don't. For some department. And, you know, for some people that works and for some people that doesn't. But that can be a really good question to ask up front, because if you do feel like you're in a place in your life where you're going to need more support, you want to know if you have a therapist who's going to be, you know, done at 5 o'clock and then not responding to anything. And you know, that you should maybe be able to make an informed decision about that. I was just thinking about, I'm currently not doing outpatient treatment. I'm only working in the inpatient setting. And I recently admitted someone to an inpatient hospital. And during the admission process, I had made a comment that I actually thought was a comment I intended to be validating to the experience of the person who I was admitting. And then I saw that person a few days later, or it was actually the next day. And she asked to speak with me and let me know that the comment I had made actually felt very invalidating to her. And I was, you know, I had a moment, what have I done? And then we took a few minutes to sit together, and she was able to explain, you know, she told me what her experience was and what the comment I had made was. And I was able to respond to it and apologize and, hear her out and validate her experience. Because the last thing I wanted to do was invalidate her, but I slipped up. Like, I did something that I thought was going to be helpful, and it turned out not to be. And I can't tell you how much I appreciate what this person did, what this patient did, because she really set the path for us to be able to work well together. I know that she has some level of comfort bringing concerns to me, and she learned a bit about my approach to addressing my own mistakes or addressing a problem that comes up in the relationship. And then she's free to decide, you know what, that doctor handled it well, or that doctor didn't handle it well, and I want to go, this is someone I would want to work with or not want to work with. And so I wanted to bring that up because I think asking the question about how you handle conflict is important. And just as important is actually bringing up concerns when you feel slighted or you feel hurt. The experience of BPD a part of that experience for a lot of people is feeling invalidated in their emotions. And it is really critical to assess how a therapist is going to respond when you feel they have invalidated you. And it doesn't mean that every time they're going to give the best answer, but if the response is invalidating or more invalidating than the initial comment, that's something to think about. And many therapists do offer consultations. It's an intro meeting to get to know each other and see if you'll work together. And sometimes they might say, I don't feel like I'm a good fit. There are people who I think are wonderful and have great goals. And I think, I don't have enough training in this particular area. And I really think this person deserves to be treated by someone who does. One last thing I wanted to say when you're looking for care is it can be really important to have people in your life who can support you through that. Because sometimes you're going to meet a therapist who's not going to meet your needs, and that can feel terrible. Especially if you hope to see someone, you make an appointment, you go to their office, or you meet them, in a telesession, and then their experience is, oh, I don't work with BPD, and there's kind of a negative feeling around that. That exists out there, and it's a very unfortunate reality. But that's not a person you want to work with. But that also, ending that session, it can be really, really useful to have someone who is a support in your life that can help you deal with the feelings that come with that while you're along the road. Because looking for treatment is complicated, whether there's, an abundance of treaters, there's a shortage of treaters, like in most other areas. So I think having that support, and that's a question I like to ask my potential patients about: who's in your life for support? Who helps you? And what kind of support do they provide? Again, I think really there isn't a question that's about a therapist's approach that's off limits. And if a therapist is balking at it, that's something to wonder about, and maybe to think through. Just is there hesitancy to answer this question a signal to me that maybe we're not going to be able to form a partnership?
Yes, absolutely. Confronting, and maybe confronting is not the right word, but yes, bringing up to therapists something that was invalidating is super important. And I think you should always give them a chance, and that's a way to do it. Obviously, if you've given them a couple chances, you can move on, and that's okay. And yes, it is a good thing. I know someone in the comments said they took it personally when the therapist didn't want to work with them, but and that's natural. But if they're like I said, if they're going to do more harm than good, then this is good information to know to move on, right? And like you said, also finding yourself an advocate, whether it's a family member or even your therapist. Like my therapist was a huge advocate for me. Like when I was in school, I was in law school at the time, and I was really struggling. And he went out of his way to write the letters I needed to get disability accommodations to be able to function and thrive in my life. And a lot of therapists won't go out of their way like that. A lot of times they're not compensated for that stuff. So I don't completely blame them. Now I'm on the other side, and I get that. But this guy really went out of his way. And so if you can find someone like that, it's obviously amazing.
So I need to interrupt you. I'm loving this conversation, and I know our everyone in the room is loving this conversation, but we're literally out of time. We had a lot of questions in the Q&A box that came up, and unfortunately we're not going to be able to get to them. But I do want to just take a minute to thank all of you, our panelists, for sharing your experiences, your resources, your guidance and wisdom for folks. Any last minute comments or thoughts that you want to leave us with?
I just wanted to say that closing out the therapy relationship, I always like it when a therapist says, this isn't necessarily by forever. And therapists who, I'm here, you could come back. And I think therapists who really understand BPD understand the attachment issue that like, I might not leave if I thought I could never come back. And then I actually have not gone back to any therapist in the past. But I kind of know the door is open. And I think that's another benefit to finding a therapist who really knows what to do with this condition and can treat it with care. And just like another sign of that. And then I also put in the chat, see if you can find a referral service in your area that might even do some of the work for you to help you find somebody so you don't have to do all the research yourself. Because sometimes there are some good referral services for, just organizations who've decided to help in that way. And of course, like Emotions Matter has a referral service. Amanda Smith can help with that. She'll actually call around in your area and find a good therapist for you. So it's okay to take help and to get support, to have somebody partner with you. You don't have to do it all on your own.
Mary or Ayala, any other last minute thoughts, comments?
I know someone in the chat asked what it's a little maybe off topic, but asked what it's like to live with BPD and also work in mental health. And I'd say it's tough in the beginning, okay? Because as we're talking about, a lot of people, even professionals, have bought into the stigma with BPD. So, and if they don't know you have BPD yourself, which of course in the beginning, you got to be careful about disclosing stuff like that. You will hear a lot of comments. I heard day after day after day from other nurses and professionals that I was working with, I hate the borderlines. That's like something that's just stuck in my head. And I would go to the cry at lunchtime. Like it was awful. But I've learned how to deal with that, and I've learned how to educate them in a tactful way where they don't get defensive. And now I work with people because of my education who love working with BPD clients and who really get it. And so I think it's really rewarding. It gives me purpose and function, and a worthwhile life to be able to do this. So just want to respond to that.
Yeah, I'm so happy that we have people who have BPD who are joining the mental health workforce or who are in it and even furthering their and careers in psychiatry, mental health, because we need people who have a real understanding of BPD. I think many people who work in mental health, I don't have BPD, I have other things, and none of us are free of issues. And when we want to pretend that the other is there's something wrong with other people, we need to really think about whether we should be treating people. I think about the many times I have heard people make disparaging comments about patients with BPD and patients with other psychiatric illness, and you don't want to be working in an environment like that, and you certainly don't want to be a patient in an environment like that. And I think it's on those of us who are treaters to really provide some education and some responses to people who are making those sort of comments, to create a safe kinds of environments for our patients. I think, hopefully people will be able to find treatment. I wanted to just make one last comment. Treatment doesn't always feel good. There are times during treatment that are really hard and painful, and that doesn't mean that the treatment isn't good or good for us. I think about times in my own therapy that have been so hard and painful, and I have felt like I hated the treatment so much, but it was because I was growing. And being able to have someone you can talk that out with to determine, is it painful because I'm growing, or is it painful because this is not a fit, or because there's something invalidating about the experience? Because if the experience is invalidating and harmful, that's a reason to find a different treatment. If the pain is because we're growing, that's a time to continue with the treatment. And I think that's not always so easy to know. And if you have a therapist who's willing to engage you in that conversation and discuss it with you, fantastic. But hopefully there are other people you can find who can also do that. And just in terms of referral sources, if you do live in a place where there's a big academic center or a hospital or some big clinic, those places to ask if they treat BPD or if they know of people in the community who do, that can be helpful. And if you live in a state where there's nothing really local, but there is something in your state, just because of the way licensing works for therapists, If you call that academic center and ask about people in the state who do remote work, you might be able to find someone who can do teletherapy, who's licensed in your state, even if they don't live in your particular town. So just wanted to put that.
Great, thank you. So thank you to all of our attendees, and thank you especially to our panelists, to Mary Ayala and Catherine Leanne. Quick plug, don't forget about our walk in June. I'm sure you'll be hearing more about that throughout the rest of the day today. So enjoy the rest of BPD Fest, and we hope to see you later on today. Have a great day, everybody. Thank you.
Thanks, everybody.
And thank you to Paula in the background, keeping track of all the questions for us.
Thank you so much.